All right, video number 4, the clean 6. And what's really important about these is making sure that we place them properly. So when we are placing these, we need to be sure and say in our heads where we are placing these and really palpate ribs to hit those intercostal muscles, right? So the first two that we place after we place our peripheral leads are V1 and V2. And these are really the easiest to sort of place because they go on either side of your sternum in the fourth intercostal space. So we feel the clavicle, then we go down, we count ribs. All right, we're in between those, right and left side of the sternum. And then we are going to skip 1, go to 4. And the way we do that is finding our midclavicular line, and we're going to hit our 5th or 6th intercostal space. Most of the time it's just 5. And then we're going to split the difference. Split that difference between 2 and 4, and that's where we're going to place 3. And then again, we are going to skip to our 6th one, and we're going to the mid-axillary line right in our armpit. We're going to find either that 6th or 7th intercostal space. We're going to place it in between there, and then we're going to split the difference for the 5th precordial lead. So the order it goes in is 1, 2, 4, 3, 6, 5. And remember that we have to hit these areas, these points like the clavicle, the midclavicular line, the mid-axillary line, because we want the best picture possible. Now, normally we won't be able to put it on patients like this because they don't tend to have issues like that unless it's Prinzmetal's angina or something like that. But, young, normally fit guys are not really our patient population. Our more normal patient population are guys like this. And kudos to this badass who decided to be an excellent candidate to show what it's like to put it on heavier set people where you can't really, or you have a hard time feeling the intercostal muscles of these patients, but that doesn't mean you get to put poor leads on. And this is what it looks like on a geezer. Remember to shave hair and again put these in appropriate spots. Are these taking good pictures of the heart? Absolutely not. Now this is one of those walking ones where they get to use telemetry in it, but still we need to place those correctly. And that lined up a little weird, but this is a woman, and how you put it on a woman. And yeah, they're placed a little bit weird, but the reason I want to show you guys this is because you can put them under bras. Just be sure and talk your patient through it to understand what you're doing, and really include them in what's happening. This is a selfie a girl took with her EKG on, and I just see constant problems with these EKG placements in that these should be placed more peripherally, and these probably need to be set a little bit lower. Do not be afraid to get in there and have it placed correctly. Just don't be a skis about it, and everything will be fine. Particularly, I don't have, sympathy for poorly placed leads, because here's the reality of the patients that we're going to be putting them on. Old ladies, grannies, and oh no, PPC, Charlie, you gotta, no, listen, you're going to see old lady boobs, and that's okay. They're fine with it. You just need to include them in what's happening. You need to get over this, ew, gross, this PC bullshit. You need to use the back of your hand to lift up the floppy boobs or the floppy whatever, the floppy folds, and just you might even need to wipe under there. There might be some stuff that you need to dry off in order to make these EKG placements stick. But this is a population that we're normally going to be placing it on. So do not be abashed. Yeah, that we are professionals and we can handle this. I'm tired of this BS about not being a professional enough to be close with your patient and just inform that, hey, I'm going to get a little close and personal because I want to take a good picture of your heart, because I take this seriously. So remember, I want good placement on all of these leads, and I have zero sympathy for poorly placed leads, because it's important on how we're taking a picture of this. And this is a great image that I found on Pinterest, actually. Not that I use it, but I couldn't find the original documentation of where this came from. but it's such a good diagram in showing, look at this, look at the y-axis, right? If we just sort of see a y-axis right here, an x-axis right here, and then a z coming out at us, we could go from this y to the x, right? This whole y right here, and it's sort of looking from the periphery in that plane. But when we look at the precordial leads, we're looking at this z-axis that's really pointing towards the heart. And you can sort of understand that intuitively when we look at the placement of here, right? We're looking straight at the heart. And when we look at the sides of these, they sort of look from a y-axis of the heart. So that's really, really cool to sort of understand these vectors that we're looking at, these electrochemical vectors that we're trying to assess. So it's important to understand that we're looking at this plane, this Z-plane on the heart. So what are we trying to assess when we look at normal 12 leads? Well, we are trying to assess this EKG that's looking at cardiac tissue, that's actually assessing coronary arteries to look for cellular damage and the resulting ion change of that cellular damage. But what's important is knowing these coronary arteries. So we have our left main coronary artery right here that flows off and goes to our left circumflex, our left anterior descending. And then we have our right coronary artery, our right main coronary artery right here. And this is the posterior aspect, the posterior view. We can actually see the left circumflex coming off and supplying this posterior aspect, along with the right coronary artery supplying the right ventricle. And a large part of the population, or actually I think it's maybe 20%, has an artery connecting these two right here, which I think is really, really cool because it just shows evolution and progression from these myocardial infarctions that have been happening. So the reason that is important is because when we look at those and we understand that, we can understand this map a little bit better. And we are going to get into that map in the next video. In fact, I will leave it right here so you guys will be able to switch from one side to the other because these maps are important. So I'll see you in the next video.